Hi, Mr. Akafo. How you doing today?
I'm doing good.
My name is Martin Kinney, and I'm going to be your nurse for the day.
Okay.
Everything okay so far?
Yes.
All right. And has anybody been here to see you yet? Are you being
I've
helped?
been waiting for 30 minutes now.
I really apologize about that. Since you've been waiting for 30 minutes, I will go ahead and try to take care of you, and we see how we'll move this forward, okay? Now, first, I'm going to ask you, could you please state your name, date of birth for me?
My name is Obi Okafor.
Obi Okafo,
14th August 1990.
4th of August 1919. Okay, and let me see. I have this wristband already, which is a nice thing to put there. Thank you so much. Before I go ahead, I'll just go ahead and close the curtain and the door so we'll have a privacy and we can talk, okay?
Fine.
All right, thank you very much. Just give me a minute. All right, now that I'm back, before I continue, I'm gonna ask you, are you in any pain today? No pain. So what brings you here, if you don't mind me asking?
I'm coughing.
You're coughing. All right, and when did this start?
Just this morning.
Just this morning?
Yeah.
Okay, and have you taken anything over the counter?
No.
You've not taken any over the counter?
No.
Okay, so apart from the cough, you don't have any pain yet?
No.
All right. Now, I'm gonna do a kind of full assessment,
Okay.
and when I do it, I'm gonna explain some of the things to you,
Okay.
and I'll tell you what my assessment would be of the situation, okay? So the first thing which I'm gonna ask or say is, I look at your general appearance, and I can say you appear well-groomed and well-dressed for your age and your cognitive level, which is awesome.
Okay.
Not a judgment at all. Now I'm gonna ask you, do you know where you are right now?
Yeah, I'm in the hospital.
And do you know the date of today?
Today's 24th.
Today's the 24th of May. Okay, and you already told me you came for the cough as primary reason. Another thing I might want to ask you, just it might seem a little silly, but there's a reason for it. Do you know who's the president of America today? Donald Trump. Okay, so I use those questions because I can confidently say you are alert and oriented to person, situation, time, and place.
Okay.
So I'll say alertness times 4.
Okay.
Now, what I'm gonna ask you is, do you have anything to eat today?
Yeah, I just had lunch.
You just had lunch. And how many meals do you have a day?
3.
3 meals a day, every day. And on those meals regularly, do you do a diet? Do you control it? Do you have certain calorie counts, or
I just eat whatever I see.
you just eat whatever you see? But looking at your physical build and all, you do some sports, so
Yeah.
okay. So I would say you keep a good nutritional status.
So,
All right, and looking at your posture and your position, I'm gonna say you stand and sit, you're relaxed, there's no pain, nothing. Awesome. I see no physical deformity so far. And is there any deformity you can tell me maybe that I don't see?
not that I know of.
All right, that's awesome. Now, I can judge your facial expression is appropriate for the situation. It's not very different. What you see is what I can depict from your face, which is awesome. And also your mood is relaxed and cooperative, more than affect, which is great. Now I've been talking to you, and I can greatly say your speech is correlated and it's cooperative too. So personal hygiene, wonderful. You're well groomed for age and situation, which I could give you praises for that. I don't know if that's against anything, but it's just my observation. Now we're gonna go to the part where I might have to touch you a little bit, and I would have to ask your permission if you don't mind.
Feel free.
All right, thank you.
But not inappropriately though.
Not at all.
Yeah.
At any time you feel uncomfortable, please let me know, or any pain,
Okay.
let me know, and we'll stop immediately, okay?
Yeah.
All right, first of all, I'm gonna look at your skin. I wanna try to get the temperature, so
Okay.
I'd feel a little bit around your arms.
Your hands are cold.
Yeah, we've been working in the cold a little bit, so I do apologize for that.
Okay.
Your skin is kind of warm to the touch, which is normal temperature for now. I mean, it's not cold in here. I hope you're comfortable with.
Yeah, I am.
All right, thank you very much. And The color is even, the temperature is fine, feels warm to the touch. And I'm gonna go now and ask you, are you sweaty? I look at everything, it's dry right now, but did you do any exercise or walk up the stairs? Are you sweaty like this shirt? Okay, so
No.
everything should be the same. If you don't mind, I'm gonna pinch your skin a little bit, just lightly.
Okay.
And what I'm trying to check for is your hydration.
Okay.
We call it sugar,
Okay.
okay? Normally your skin should respond and return with this elasticity,
Okay.
okay? So, just a little bit. That shows me everything is normal, which is awesome, okay? I'll also check the same thing up here, which is a little better. Thank you for that. All right, when I look at your skin, like I said, I don't see any, do you have any birthmarks anywhere?
No.
No birthmarks. Haven't had anything like smallpox or anything that left a mark or wound, a tattoo, none of those?
No.
All right, that is awesome, thank you very much. Could you please stretch your hands out to me? All right, now I'm gonna look at your nails, and at the same time, I'm pressing them a bit because I'm checking the capillary refill,
Okay.
which I observe to be under 2 seconds, which is normal and awesome. I can just check your palms, that's fine. Thank you for that. I'm gonna proceed now. Your nails, I could describe them as translucent. Normally, if your nails have a problem, they could be flaky, but everything about your nails tells me it's right and it has the correct angle.
Okay.
So I see no problems with your nails right now from my observation. I'm gonna proceed. I'm coming up to your eyes, okay? And let me do my hand hygiene. Okay, just give me a moment, okay? I would need a light, a pen light. Okay, I got one here. All right. I would use this at some point, but first off, if you don't mind, could you stand up for me, please? Thank you. All right, while you're facing me, I'm gonna do this test, which is called confrontation. What you're gonna do
That
is
sounds aggressive.
cover, no, it's not the aggressive confrontation.
Okay.
I'll explain to you what it is if you want to know. All I'm trying to do is test your field of vision, okay? And see how good it is compared to mine and compared to every other regular person, non-aggressive. So please cover your right eye with one hand. All right, now I'm stretching this hand out. And whenever you see the hand come into your field of vision, let me know. Just keep looking straight at me, okay? All right, tell me when you see it. All right, I'll do the same thing from up. Keep looking straight at me. Tell me when you see it.
Yeah.
Okay. I'll do the same thing from below. Tell me when you see it.
Yeah.
All right. Now we're gonna switch hands. Do the same thing. Keep looking straight at me, and I'll do it with the other hand. Okay.
Okay.
When you see it coming into vision, let me know.
Yep.
Okay. I'll do the same in the middle when you see it coming.
Yep.
All right. And I'll do the same below when you see it coming. Let me know.
Yep.
All right. That's awesome. Now I look into your eyes and I'm gonna look at your conjunctiva. And I apologize because I'm gonna shine a little bit of light into your eyes, okay? Okay. All right. They look pink, moist. And now I wanna look at your sclera, okay? I'm gonna pull your eyes down a little bit. Just look straight at me. Vascular, white, which is normal. Now I'm gonna do a couple of things with the lights, okay? First of all, I'll point this directly at you. I'm sorry, let me check this, okay. I'll point this directly at your eyes, just keep looking straight at me. I'm trying to check your corneal light reflexes, okay? And just look straight at me. All right, The light should reflect on both eyes at the same place, which is what I'm seeing right now. So it tells me everything is normal. The next thing I'm gonna do is I'm gonna check your iris and your response to light, okay? First, I'll point you to this eye. I see the reaction, and I'm coming back to the same eye, okay? Just look straight at me, okay? Both of them are responding equally. Now I'm gonna try the next. Okay, and I'll look at the other. And both of them are responding equally, thank you. Now looking at your eye, I looked at your pupils, and I would say estimated it's 4 millimeters. For everybody, normally it's between 3 and 5 millimeters, so that's awesome. Now, I would like to check, just one moment. I was just doing a double verification, but nothing to worry about, okay? All right, I'd say the cornea are transparent, clear, awesome color. I did the pupils, and now I'm gonna do something which we call accommodation. Accommodation is more of you trying to look at things far and near distance, okay?
Okay.
So I'm gonna have my finger right here. Focus on this finger.
Yeah.
Now, focus on any object far behind me, like a window or a desk or a chair. Now refocus on my finger.
Okay.
Look back again at the window or the chair. Awesome. Thank you very much. If you don't mind, you can please sit down. Yes, thank you. All right, now I'm gonna have to touch your ears. Okay? I'm gonna feel the flaps of your ears first. Do you feel any pain?
No.
All right, that is awesome. No pain. Do you feel any pain right here?
No.
These are the targus, no pain. All right, the outer pinna are symmetrical. They are aligned with the eyes, and they are soft to touch with no pain. Thank you very much. All right, now I'm gonna concentrate a bit on your head, your face, and your nose, okay? Please look straight at me, and I'm gonna work on your facial symmetry. The symmetry of your face, I'm checking one of your cranial nerves, and this one is gonna be cranial nerve number 7. So, first, I want you to raise both eyebrows at once, just like I'm doing, okay? Now blow out like I do. Okay, and now do a wide smile, just like me. All right, everything is moving symmetrical all around. Nothing is moving later than the other, which is awesome. All right, now I'm gonna start by checking your scalp, okay? I'm gonna touch a little bit of your scalp. All around, regular, no deformities. Your hair is evenly distributed. The cranium is round. I feel no nodules. And now I'll come down to your temporomandibular joint. Could you please bite down for me? Okay, bite down again. And then now could you move your jaw left to right? All right. I feel no crackles, which means the joint is right and okay. Now I'm gonna check your sinuses, okay? I'm just gonna tap on them lightly. Tell me if you feel any pain or tenderness.
Okay.
Right here, your frontal. All right. And your maxillary, do you feel any pain or tenderness? All right, that is awesome. All right, still on your face, I'm gonna do a couple of sensations. One of them is gonna be soft and the other one is gonna be hard. And all I need you to do is let me know when I touch you, okay?
Okay.
You would need to close your eyes for this one, all right? Thank you. So every time I touch you, let me know if it is soft or hard and where I touched you. You ready?
Yeah. So.
Awesome. Means the nerves is working fine. All right. Now I'm going to check your nostrils, and I would like to use my pen light. Do me a favor. Could you please take your head up for me? Just going to make sure it's clear pink and the septum is where it's supposed to be, which I see. And now just, if you could, cover one of your nostrils. Take a deep breath in with the other one. I'm checking for the patency. Now do with the other one, same thing. Deep breath in. All right, that's awesome. No blocks, everything is clear. All right, now I'm gonna check your mouth and throat. And I'm just gonna use this as a depressor. All right, and now we need the light, okay? If you don't mind, could you please open your mouth wide for me? All right. All right. All right. I see all your teeth are in there. Could you say ah, ah? All right. When you did that sound for me, I was checking your uvula. Normally, I would do the gap reflex, but since it's a little invasive and uncomfortable, what I'd rather do is, could you take your head up a little bit for me? Swallow. All right, I felt that movement, which is probably the same. Now your tongue, could you stick it out for me? Move it from left to right. All right, thank you very much. Now I can say the uvula was fine. Your lips are smooth, the buccal mucosa looks good, all your teeth are present, and I didn't see any lesions. So overall, the mouth looks good. Now I'm gonna go to your neck. And for me, the things I'm gonna do here is mostly gonna be, I'm sorry. Excuse me.
You might cough.
No, not that. I just felt like something was in my throat. I'm sorry about that. Let me do my hand hygiene. I'll be right back. All right. So I'm sorry about that. Now I'm going to check your lymph nodes. Okay. First of all, I'm going to start with your pre-auricular lymph nodes. I'll try to feel if there's any. Normally we do this to check for infection. And then now I'm going to check your post-auricular lymph nodes. Checking for any infections. And now I'm going to do your occipital lymph nodes. And finally, I'm going to do the submandibular. I didn't feel any of them. Normally they get swollen if there's an infection, so none is swollen. And now finally, I'm going to check your muscle strength, okay? First off, I'm going to use this hand. I'm going to try to push on your face, and you try to counter the force, okay? You push against my hand, all right? Do the same thing on this side, all right? And then your shoulders, I'll push down on your shoulders, and you're going to push up against my hands. All right, that was your cranial nerve 11 I was checking. Overall, everything looks good. Now I'll make sure I inform the doctor about your cough. I'm gonna do something about it right away, okay?
Okay. Thank you.
You're welcome.
I'll be waiting.